Well, good afternoon everyone, and thank you for taking the time to watch and listen today. First, I would like to reflect on the situation here on the Isle of Man, and I'm pleased to be able to report that since my update last week, we have had no new cases of COVID-19 detected in the Isle of Man. Of the 4 cases in recent weeks detected, all of the people who were already isolating, only one of them remains, of their cases remains active, and that individual remains, of course, in the extended 14-day period of self-isolation. As I've said time and time again, respecting the rules which have been put in place to prevent the virus from taking grip and once again circulating in our community is our most important line of defence. If you are a returning resident or a key worker upon arrival on the Isle of Man, you must go directly from the airport or the sea terminal to your home or accommodation. It is disappointing that there has again been instances this week when people have failed to follow this clear and simple rule. But we must remember, despite instances such as this, that the vast majority of returning residents and key workers coming to the island do follow the rules. And my thanks to all of those who are behaving responsibly and helping to protect our community. On this point, the Health and Social Care Minister David Ashford would like to emphasise some important points about self-isolation. David.
Thank you, Chief Minister. I think it's a very good opportunity to re-emphasise what self-isolation in the home actually means. So for those that are self-isolating at home, it means you should be away from any other members of the household. If you have to share facilities such as bathrooms or kitchens, they should be cleaned down after every use. If it is not possible for someone to self-isolate within the home in that way, away from other family members, then there are 2 options. There is the option where they can find another premise to self-isolate where they are on their own, but if that is not practical and they do have to mingle with other household members, then under the rules that means the whole household should self-isolate. So it needs to be clear what self-isolation in the home is, and I think it's a good timely reminder to put that out there for people. Thank you, Chief Minister.
Okay, thank you very much, David. Now, I know self-isolation with other householders can be challenging, particularly where there are close quarters or young people, for example. But it is so important that people take the necessary steps that David has set out. These will protect loved ones at home, which in turn will protect our wider community. Turning our attention to the United Kingdom, it has been another difficult week. Yesterday, the Prime Minister described the UK as being at a critical moment with a rising number of cases, hospital admissions and, very sadly, deaths. The north of England continues to struggle with the virus, with Liverpool, Manchester and Newcastle having over 4 times the average UK level of infection. Indeed, new stricter rules in these areas have been unveiled today to help tackle the spread of the virus. The United Kingdom this week reached a new high for the number of COVID-19 cases detected in a single day, at 7,143. Now, we must put this into context, however, with the significant increase in testing in the United Kingdom in recent months compared to the peak that we saw in May. But as the Prime Minister made clear, despite this context, there is no room for complacency. Cases, hospital admissions and deaths are rising. The encouraging news is that the spread of the virus appears to be slower than the worst case scenarios set out last week by the UK's scientific advisors. Last week I set out the Council of Ministers' intention to review our borders framework, in particular for splitting Level 3 into 2 parts. Level 3A would allow residents to sponsor immediate family members to come to the island, with Level 3B allowing businesses to sponsor visitors. Now, given the situation in the United Kingdom, it is clear that now is not the time to relax our border restrictions, and so we remain on Level 4 of the borders framework. I am pleased to advise, however, that this morning the Council of Ministers further explored how a move to Level 3A and 3B might work in practice. We need to ensure that we have the appropriate processes and procedures in time for when the time is right for us to move ahead with this. And I hope to be able to talk about this in more detail at a future briefing. Looking more broadly, this week saw a sombre moment in the global struggle against the virus, with deaths reaching 1 million, according to researchers at Johns Hopkins University. The UN Secretary General called it a mind-numbing figure and an agonising milestone. These developments, both close to home and further afield, serve as a stark reminder that despite the position we find ourselves in here on the Isle of Man, with local elimination of the virus achieved and 121 days since a new case was detected within our community, the battle is far from over, especially as the Northern Hemisphere approaches the winter months. And that is the topic I wish to focus on today, being prepared for winter, where each year every country sees a spike in hospital admissions and, very sadly, deaths. Protecting vulnerable groups against winter flu is one of the most important ways of saving lives and reducing hospital admissions during the winter months. And that's why for many years we have provided vulnerable people with a free flu vaccination. We are COVID-free at the moment, but as we know, a return of the virus and its circulation in our community will see an increase in hospital admissions, placing a significant strain on our health and social care services. Should the virus return to our community, we must be prepared, and protecting vulnerable people against flu is vital to those preparations. We have two guests with us today to talk about our flu vaccination programme. Dr. Henrietta Hewitt, Director of Public Health, and Sam Neen, a specialist community public health nurse. First, I would like to invite Henrietta to speak to you. Henrietta.
Thank you, Chief Minister. I'll talk generally about the flu vaccination programme, and then my colleague Sam will talk particularly about the arrangements for the new addition to that programme this year, which is the Healthy Child Vaccination Programme. The Chief Minister has already set the scene for what happens every autumn and winter, which is a rise in respiratory infections generally, and nearly always a surge of the particular influenza viruses that are circulating in any given year. And as people will be familiar with, those viruses differ year on year. They don't remain the same. And that's why vaccination has to be done every year. You can't have one vaccination that lasts for a number of years. There are some people who are at greater risk of side effects and complications if they contract flu, and they are the main focus of our flu vaccination programme. So the existing programme, which as Chief Minister said has been in place for many years, has for a long time included all those aged over 65 and then people below 65 who have a defined list of underlying clinical conditions, and indeed pregnant women. All those people are at increased risk from flu and are very much encouraged to get their flu jab, which they can access through their GP surgery or through a community pharmacy. Frontline health and care workers also have a flu vaccination programme, which is delivered through Department of Health and Social Care's Occupational Health Service, and some other employers also organise flu vaccination for other people. So if anyone is concerned as to whether they're eligible or not, if you go onto the flu programme website pages, which are about to be launched, and I don't actually have the website address with me, but we can follow up with that later. You can find out if you're in one of the eligible groups, and if not, you can make inquiries of your employer to see whether they have a programme that would cover you. In addition to that, I think we're now ready to hand over to look at the Healthy Children's Flu Vaccination Programme. Worth saying that that's in addition to the long-standing Children with Underlying Health Conditions programme, which has also been in place for many years, but the big addition this year is going to be the Healthy Children's Vaccination Programme.
Okay, thank you very much, Henrietta. I'd now like to invite Sam to speak to us.
Hi. Thank you, Chief Minister. I just want to talk to you about the Healthy Child Flu Vaccination Programme, which is being introduced this year. Flu vaccination, as Dr. Hewitt has said, has been offered to children with underlying health conditions for many years. However, this is the first year that we're extending the flu vaccination programme to include all children between the ages of 2 and 10 years old. We know flu can be an unpleasant illness no matter what age you are. At best, if children catch it, they're usually off from school for a few days. But for some children, it can cause serious health complications such as bronchitis or pneumonia, which may result in hospital treatment. The introduction of the childhood flu programme was planned long before COVID-19, but as Dr. Hewitt and the Chief Minister have outlined, the fact that we're in the middle of a pandemic brings added impetus to help protect vulnerable people from seasonal flu. In doing so, we will also protect our health services during the busy winter months. The vaccine that we offer children is different to the one that we offer adults. You'll be pleased to hear that there's no needles involved. It's given as a simple nasal spray, which is just 0.1 ml administered into each nostril, and that's equivalent to just about 1/50th of a teaspoon. It's quick, easy and painless. The vaccination has been given across the UK since 2013 to children in schools and also used in many other countries worldwide. As such, it's been given to millions of children. We know that the vaccine is both safe and effective. So why is vaccinating children important? Firstly, it can help protect your children from flu and the potential serious complications it can cause. Secondly, if children are protected from getting flu, the likelihood of them spreading that virus is greatly reduced. So getting your child vaccinated not only helps protect them, but also their family and the wider community. And thirdly, it will help protect our island's health service. We know that children under the age of 5 have the highest rates of hospital admission due to flu. And last year, 34 children were admitted to Nobles Hospital with flu. It's horrible for the children, their carers, and of course puts tremendous pressure on our health service. So where will children receive their vaccine? If your child is aged 2, 3 or 4, but not yet at school, they will have their vaccine at their GP surgery. If your child's in primary school, they will receive their vaccine in schools. Over the summer, consent forms were sent to parents of primary school children. If for some reason you've not received your form or you've misplaced it, there's still time to consent. Additional forms can be downloaded from our website or obtained from your child's school and returned via email or post. Our school vaccination programme starts next Thursday and we'll be visiting all the island's primary schools over the coming weeks. One group that we really want to reach out to is home educated children. We're holding specific sessions for these children. Again, all you need to do is download a form from our website, send it to us and we'll get in touch with you. For further information on the childhood flu programme and additional forms, they can be found at our website, which is www.gov.im/childhood-flu, or if you have a specific query relating to the school flu programme, you can call me on 686 709 or email me at fluvaccinationiinquiries.dhs@gov.im. Thank you.
Okay, well, thank you very much, the pair of you, and some very helpful and important information there, and a clear message. If you are eligible for a free flu vaccination this year, please have it. Protect yourselves, your loved ones, our community, and our NHS this winter. Now, before turning to questions from the media, I would like to take a minute to touch on a different topic. With all that we've been through over the last 6 months, it is easy to forget that the other issue that was taking up so much of our time at the start of the year, namely the UK's negotiations with the European Union. The United Kingdom, and of course, left the European Union in January of this year, and they, in effect, we also, then entered a transition period while the two sides worked out their future relationship. The arrival of COVID caused delays and disruption for a few months, but then face-to-face negotiations resumed at the end of June. The United Kingdom has been negotiating on behalf of the Isle of Man and other Crown dependencies, and the lines of communication between us have been solid. Those who have been following this through the United Kingdom media will know that the negotiations have been challenging, and it seems that every week is a crucial week. Over the next few weeks, we should have a clearer idea of what deal the two sides might agree and what the impact on the Isle of Man will be. As soon as we know, I will let you know. There is, of course, a possibility that the two sides cannot agree a way forward. If this happens, I want to reassure you that we will have plans in place. We planned for a no-deal outcome at the end of last year, and this would be very similar. Again, if this happens, I will talk to you about it. In the meantime, there are a number of things to think about, regardless of the outcome of the negotiations. If you travel to the EU, export to the EU, or come from the EU, there could be something you need to do. Again, much of this we talked about at the end of last year. We are updating our websites and reissuing the guide that I know so many people found helpful last year. You will see some messages from us on social media and in the media, and we will come back to it in these briefings as well. And now to questions from the media, and first we have is Alex Bell from the BBC Isle of Man. Good afternoon, Alex. Faster Mai.
Good afternoon, Faster Mai. So no movement in the border policies again today. We're hearing from Manx people who live in various parts of the world, including the UK, who are now fairly desperate to come back home and see loved ones. And they're asking me, just how are they more of a risk than people who live here, leave the island and return?
Well, I think you asked this question last week too, Alex, and the answer is the same. It's adding increased numbers coming on into our island who may have the infection rate. We've seen that most of the people of where we have family loved ones live in the northwest of England, and those regions currently have 4 times the number of infection rates compared with the UK average. That said, the Council of Ministers is sympathetic to the plight of people living off the island who have loved ones on the Isle of Man, and we are working to come up with a strategy that when the figures improve in the United Kingdom and we deem it safe to movement to 3A, we will just as soon as possible. I don't know, David, if you want to add anything to that.
Yeah, just to say, again, it's to emphasise what I said to you last week, Alex, that we've got to take into account what is happening in our near neighbour, the UK. And as I said, whichever measure you use, be it a 3-day average, a 7-day average, or you use it as the physical number of cases or the proportion of tests coming back, the UK has exponentially been rising. Now, it does appear to be potentially some levelling off now, but we need to make sure that that is actually happening. But even then, it's levelling off from a higher place than they even were at the peak of the virus earlier in the year. So it's important that we don't lose the context around this. It is a desperate situation for many people who do want to see their loved ones on the island, and we recognise that, and that's precisely why we have created this 3A. It's around timing when we can move to that safely, because we have to recognise that there is an impact on the island community as well.
Yeah, if I can finish by saying, Alex, that I have received a lot of emails from people who've listened to the broadcast regarding 3A and who are appreciative of that and see that now isn't the time, but they are glad that they will have the opportunity the minute things start to ease to come over to visit their loved ones on the island. So it's not that we don't want them, but we have to protect the general Manx public.
These people would be self-isolating, though, in the same way that anybody else self-isolates, though. Does that not bring the risk down to the same level?
Well, it brings the risk down, Alex, but you are increasing the number of people coming to the island who potentially could be bringing an infection, and you obviously have to take into account the risk factor and the levels of infection in the United Kingdom, which sadly they have the highest levels they've ever had. So with that taken into account, we just couldn't open the borders at this moment in time. But obviously, the minute we can move on to level 3A, we will.
And do you have any idea when that might be then?
Well, in a perfect world, I would like it to be this year. It really is how long is a piece of string. If you analyse where the UK are at the moment in time, they're at stage 4. Now, the highest stage they can go to is full lockdown at stage 5. If the UK, who are going through an exponential rise in cases, see an improvement, then the minute we feel safe, we will of course move there. But it would be foolish of me to say on the 25th of October we're going to move to 3A, because we just clearly, I'm afraid, don't know. But the minute we feel safe to, please rest assured we will move. Thank you very much. We now move on to Tim Glover from Manx Radio. Good afternoon, Tim. Fast am I.
Fastamai, Chief Minister and Health Minister. First question, can you give me a current definition of what a key worker is?
Well, a key worker is someone that is deemed as essential for the Isle of Man to help either the economy or our health service or businesses going forward. So we will have in that doctors, medics, nurses, people that businesses have said they cannot find the skill on the Isle of Man and they need it. So we've had people coming over to fix the power station, for example, not the power station, the energy from waste plant, that we didn't have that skill on the island. So there are a number of definitions, but that's a very broad definition of what a key worker is. I don't know, David, if you want to add anything to that.
Yeah, just to say the key things are around work that basically is for the preservation of life on the island, that is national infrastructure work that can't be undertaken by anyone else on island. So example I can give from health and social care is key workers coming into the island, for instance, are the oxygen deliveries. So we have the drivers who drive the tankers in, they come in, they deliver the oxygen supplies, they drive straight back out again. So the difference is with a lot of key workers, they don't actually spend any real time out and about in the island. They go straight to their place of work and then straight back off island again.
Okay, Tim.
Can I just follow up on that one before moving to my second question? Would you therefore class 5 welders from Doncaster working on the Manx Electric Railway as key workers?
Well, again, this is adjudicated by our team, who look to see, are they specialist welders, and is the specialist welding of railways something that we don't have a skill on the island? That's obviously been adjudicated as being specialist, and therefore a key worker status was granted.
And the second question just follows on from that, and we've had these cases that you alluded to right at the start of this press briefing this week. You said we have clear and simple rules to follow, but are they clear and simple to the key workers and others who are coming over? One of the advocates in the case of the 3 Welsh key workers who were in court said that it was a verbosely written 5-page document that they need to go through. Do government and companies need to really spell out what key workers and anyone else coming to the island has to do?
Well, I think first and foremost, Tim, I'm led to believe that the company that brought over the key workers clearly told them they could not go out to Tesco's to get supplies. They broke that advice. So the company that they work for, that when they come over to the island, has to fill out a clear risk assessment of how they will be brought over, where they will stay, and how they will move to the work that they have to do. So you can't, it's a very detailed document which clearly sets out what has to be done. You can't do much more telling people, that you must follow the rules. You go straight from the port, whether it be the air or sea, to your accommodation, to your home. Now, we are obviously, as a result of this breach, looking at ways of further drilling it into people when they either come on the boat or the plane about that. And maybe when the video on the steam packet boat or the tannoy announcements on the plane happen, we could ask for that to be repeated time and time again. But I mean, I personally cannot accept that the people coming to the island do not know that they are not allowed to go out from the ports to buy in shops. They must go straight to their accommodation. So I'm afraid it's not an excuse that I can accept, that they didn't know or understand.
But are you worried that we are seeing an increase in cases?
Well, I'm concerned that we're seeing this, and obviously as Council of Ministers we're concerned, and we will be seeing if there's any way we can tighten up the messaging to these people. But equally, they are being reported, they're being caught, and action is being taken. But yeah, I'm disappointed with anyone breaking the rules because it puts our whole community at risk. Thank you very much, Tim.
Thank you.
Okay, next we've got Rob Pritchard from 3FM. Good afternoon, Rob. Faster Mai.
Faster Mai, Chief Minister. My first question, again, just on the subject of key workers. What consideration is given when key workers are invited to come over and they have the right exemptions as to what area they're coming from? Because particularly if you have those key workers coming from areas where we're seeing, for example, local lockdowns like the ones introduced in Liverpool and Warrington today, that statistically the chance of them bringing the virus over is higher, no matter how responsible they actually are.
Well, obviously, sadly, all around the Isle of Man, whether it be Northern Ireland or the north of England, they are effectively the highest regions in the United Kingdom, and therefore it all comes with a risk. But obviously, there are key assessments of these people. If it's medics, they're tested by our health services, and that's where we've been able to spot a couple of the cases that we've had recently. David, I don't know if you want to expand on that.
Yeah, just to say, Rob, that obviously there is a full assessment done of any key worker that's coming over, the work they may need to undertake. The duties that they undertake may be limited. There may be social distancing employed and required for that role, where necessary, appropriate PPE to be used. So there is mitigation taken within the place of work as well. And obviously outside of the place of work, as has been stressed again, I will stress it once more, they need to self-isolate. They are not allowed out into the community and they are committing an offence should they do so. So with key workers, it's not just a case of they go to work and they actually mix. There is very clear restrictions normally within the place of work as well as to what tasks they can undertake and how they go about doing their job.
Thank you. My second question, just regarding the flu vaccinations that you've announced. When that does start, there is likely to be a rise in demand. People want to get it as early as they possibly can. So that might lead to more backlogs possibly in being able to deliver those. I just wondered, for those who do qualify, do you expect any particular average waiting times that people might have to wait to make sure they get it?
Well, in terms of the vaccinations, Rob, the vaccination programme is already underway. We're not aware of any delays whatsoever. We're not aware of any supply problems either. I know people who've already had the vaccination. So as far as we're aware, everything is running as normal.
Thank you.
Okay. Thank you very much, Rob. And we now move on to Sam Turton from Isle of Man Newspapers. Good afternoon, Sam. Faster Mai.
Faster Mai, Chief Minister. I just wonder if we could start vaccinations on that. Why is the target 2 to 10? Why is it not extending up through full primary school age?
Right, David, do you want to expand on that, or do you need one of the team?
I'll bring one of the team in to talk about that. Henrietta, would you like to come in?
I'm not sure I entirely heard the full question. You were breaking up a
I
bit.
think just why 0 to 10 and not slightly older as well.
It's not 0 to 10. It's 2 till 10, which effectively includes everybody in primary school and a couple of years below that. We don't offer the vaccine to children younger than 2 because it doesn't actually work very well in them, and it is associated with more side effects in very young children. So that's the reason for the cut-off. World, one might roll out the Healthy Child Vaccination Programme to all secondary children as well, and that's the long-term aim of the Healthy Child Vaccine Programme. But obviously for logistical and supply reasons, both across as well as here, it's not possible to do it all at once, so the high priority groups are picked up. And in terms of the younger children, the big issue around them is not only, as my colleague Sam explained, that a lot of them actually do end up in hospital each year as a result of flu, which obviously we want to avoid, but also because younger children act as what are known as super spreaders. They may be either asymptomatic themselves or just have very mild symptoms, but they often come in contact with a lot of other people who may be vulnerable, including grandparents or other friends and relatives who have an underlying health condition, and they can unwittingly transmit flu virus that way. So by prioritising that age group of children, we're not only protecting them, we're protecting the wider community as well.
Okay, thanks very much, Sam. Your next question.
Yeah. Oh, actually, just a point of clarification I've just been asked to raise. Are we going to be doing weekly briefings at this stage, or are we sort of planning week by week?
Well, we hope to do one every Thursday. I was concerned that when we did a media briefing, because we hadn't done any for a while, because we didn't feel there was no cases, the need to have the discussion, that people were panicking a little bit, thinking there was going to be a major announcement. So we thought, well, if we do one every Thursday, then we can give people a general update as to where we are. And obviously there are other things such as the transition period regarding the transition on Brexit to update the public on. So we thought we would make this as varied as possible. And obviously when we can give you information regarding 3A, the borders movement, and plans for our students to come back to the island during the Christmas period, we will obviously give you all that information too. So the plan is every Thursday going forward. Okay, thank you very much, Sam. And okay. And last but not least, Simon Richardson from Business 365. Hi, Simon. Good afternoon. Pastor Mai.
Good afternoon, Chief Minister, Pastor Mai. And firstly, could I just pick up on Tim's point a little earlier? I think everybody who lives on the Isle of Man is pretty much aware of the stringent application of the quarantine regulations and accepts them as a necessary protection. But I recently returned on the boat, and I must admit I was very surprised that there were no tannoy announcements reminding people that they must head straight home without stopping and possibly warning of the consequences. Is this something the government could actually require the steam packet and maybe the airlines to actually do during all transport? Because I understand that the 3 people who were arrested after they arrived and went to a shop, they were wearing masks, which suggests that there was, a sense of responsibility there and maybe some kind of misunderstanding.
Yeah, well, you could maybe accept that rule if they didn't have to fill out full details of how they were going to come to the Isle of Man and where they were going to live and carry out their work. So they knew the rules, they had been advised on. But I have today, during Council of Ministers, we have agreed as a council that we will ask the steam packet and the airplane companies to the airlines, I should say, to do an announcement reminding people. But we are reminding people of something that they already know. So it's it's not that they haven't been told. They have chosen. They were told by their sponsoring company that they could not go out. They broke that rule. So I'm not here to defend them in any way, shape or form. They clearly knew the rules. They broke them. They ended up in court. So, but yes, anything that we can do to refresh their memories of people travelling to the island, then of course we will do our utmost. And your next question, Simon.
Yeah, I just wondered, has the government had any conversation or talks with EasyJet recently? Is the airline applying any pressure in respect of restoring Isle of Man services, or are they happy to go along with things pretty much as they are?
Well, obviously EasyJet aren't going to want to operate to the island if there's not a significant number of people to use their planes to fill the seats. Obviously, they've got cost overheads to operate. So to say they've put pressure on us, the answer is no, they haven't. Obviously, we are keen to see their links that they provide for us set up as quickly as possible. But obviously, it's once we are at least at 3A, if not 3B. On our borders policy, Simon. So thank you very much. Okay, well, thank you very much for your questions today. I'm conscious that we've covered a lot of ground today, but I hope that the briefing has been useful. The one overriding message today is for our vulnerable people here on our island. Protect yourself, your loved ones, our community and the NHS. If you are eligible in the eligible group, please do get your free flu vaccine this winter. That's all for today. Thank you again for your time. Good afternoon.